Mental health is extremely important when it comes to handling any situation in life, especially diseases and especially a disease such as MND. Patients come to know the moment I'm suffering from MND, they Google it and the first thing they read is you're going to die maximum 4 years. This thought itself brings the patient down. So what I have been doing and what I think should be done is number one. Hello, Namaste, Assalamu Alaikum, Sat Sri Akal. Dr. Naeem Sadiq, neurologist, neuropsychiatrist, founder and director of Plexus Neuro and Stem Cell Research Center.
Welcome to the Dr. Brain STEM podcast, your portal to understanding the complexities of neurological disorders. Today with Plexus, we're focusing on breakthroughs in treatments for ALS, importance of technology as an aid, and debunking myths in part 2 of the podcast. Together, we're committed to raising awareness, enhancing knowledge, and exploring how this condition affects the daily lives of patients and their families. Guiding us through today's discussion is Ms. Kanishka, a seasoned occupational therapist with a master's in occupational therapy and the head of the Department of Rehabilitation.
So after we've spoken about the symptoms, the early stages, then the stages of the disease and the diagnostic criteria of amyotrophic lateral sclerosis, now let's talk about some good things. So would you like to tell us about the treatment? Now, what are the things which are right at the horizon with respect to treatment of ALS? Is there any hope?
Yes, there is hope. There is hope. There's, in fact, I would say there's a lot of hope. Now, if you look at the treatment aspects, now we have on one side certain pharmaceutical agents, certain drugs. Like for instance, you have number one, Riluzole, which is an age-old medication, which has been going on for I think more than 30 odd years now. I think so. It is supposed to, prolong, the life of the patient. Then we have a very powerful antioxidant, edaravone, which is given in the form of injection. And another drug which was approved by the US FDA was sodium phenylbutyrate, or that works at the cellular level. Now, besides this, there is a lot of work going on in terms of newer molecules, newer drugs, which are yet to see the daylight. But besides medication, the other thing which is now making huge progress is number one, gene therapy, where they are trying to alter the mutations in the genes. And the other one which is holding huge promise is stem cell therapy, where we believe, or one of the hypotheses for ALS and MND is that there could be some immune downregulation there. So stem cells are known to boost the immunity and help in immune modulation. So there are different types of stem cells which are being used, and a lot of work is going on, and there are a lot of promising results which are emerging in terms of cellular therapies or stem cell therapies or regenerative medicine. Besides this, we have lot of other treatment approaches, like immune modulators, neuroprotective agents. Lot of work is going on in terms of the messenger RNA. So these are things which are ongoing, and there is a huge trial which is going on, the HALE-C trial, drug trial, and then there's one more trial by the ALS Foundation, which is going on. So we just hope and pray, something emerges out of it. But at the moment, yes, there are certain drugs, and we have an option of gene therapy, we have an option of cellular therapy when it comes to managing the patients.
Right. So can you tell us a little more about stem cell therapy? You said there are so many types of cells, and so what is it that you exactly deal with? And with respect to stem cell therapy, some more light about the type of cells, say, what do you do and how does it help?
Yeah, like I was mentioning, there is a belief motor neuron disease, ALS, has some kind of down regulation in the immunity. So now stem cells are known to potentiate the immune system of an individual. The different type of cells which we use, most importantly, is the autologous stem cells, which are derived from the bone marrow. Besides this, we also have the mesenchymal stem cells, the MSCs, which are derived from the umbilical cord. We have the iPSCs, we have the neural stem cells. All these are there, which are being used right now, and there are some good results, and we are seeing the disease is either being stopped or delay in the progression and increase the longevity of the patient and delay his entry to the ICU, which is what I would look at to give a patient comfortable life, improve his quality of life. Yes, there is no cure. There's no cure in either of these remedies which are there so far, which are starting from the 90s, starting from riluzole, edaravone, phenylbutyrate, nothing can be said that it is a cure. But we are only looking at improving the quality of life of the patient and delaying the entry to the ICU and delaying the ventilator.
Delaying the progression.
Exactly.
Slowing down the disease process.
Down. Stabilize the patient, which I have. I have so many patients now. 2012, 2013. They are maintaining. 4 years, 5 years, 6 years, 10 years.
That's great.
Yeah, it's good. In fact, some of the patients who have been on regular follow-ups with me, they had come on wheelchair. Now they are walking with a walker. One of my most notable patient is a guy who could not walk. He bought a scooter. He sent me the video. He bought a car. He sent me the video. I have so many such examples. So many of this so-called incurable disease. We are trying to make their life better, slow it down, stop it, make their life better. And it is working. Yeah, lot of patients I have who have come here to Plexus and who have had cure is not there.
So you've been able to defy the notion where so much research is done and it says that after the diagnosis, the life expectancy is 5 years, 3 to 5 years. So you've been able to change that.
I cannot say that. I have to be modest in saying that. I have just tried my best and things have happened. Like I always say, it is a confluence of several factors which are there in the universe which bring about change. So this was one factor which has helped these people.
So we're in the age of AI and there's so much happening around with AI and technology. So how has technology evolved over the years and how is it helping patients with ALS as their disease is progressing from one stage to the other?
It is doing lots. It's doing lots, and in fact, that is yet another field which I keep encouraging my patients to go for it, rather than like I was talking about the PEG tube or have a tube to feed and get the nutrition. Similar is a concept here. Rather than just wait for the speech to come back, wait for your fingers to start working. No, we are in an era now where we can do lots. Like we have the voice recognition technique. We have the technique by which speech to text and text to speech. You don't need to, by typing the speech can be done. So that's something which patients can use. Then number 2, we have a technique where you can communicate only with your eye tracking. Okay, using technology. It's the computer is set in such a way by making those particular eye movements. Those actions are initiated and you can give commands. Now, talking about this, it reminds me of what Stephen Hawking did. Intel had made a device for Stephen Hawking where he would just twitch the cheek and there was a sensor which was placed in his specs by which he could initiate so many actions. And he was a known physicist. He had so much he gave to this entire world. He did not just give up. So use of technology, so the voice, the eye tracking. Now along with this, lot of other things like assisted devices for mobility. You have things where automated wheelchairs and so many other things which are available right now. And of course, remote monitoring, smart homes. These are some of the things which are available, which can be used, which should be used rather than just surrender and give up and say my life has come to an end. In fact, I remember one of those earlier days when I used to see these patients where we did not even use technology, something which I just remembered when I was talking about eye tracking, how we used to train the patients, to blink once and to blink twice and to blink thrice, by which, the person gets he gets, rather than struggling, which was so frustrating. Is this there? Is it this? Do you want this? Do you want to go to the loo? Do you want to eat? It frustrates the patient, it frustrates the caregiver. Now, having a simple technique, you blink once, it's yes, you blink twice, it's no. You're not even using technology. So, I think now when we have these things available, it has to be used. Patients and caregivers should just go for it and adapt these things. It'll help a lot. Give the patient so much of ease, so much of comfort. He or she is able to communicate to the caregivers, and caregivers feel so good. They're able to fulfill the patient's needs despite the person not being able to speak.
Okay, now talking about mental health and coping strategies. So what are some of the strategies that you would advise for patients who are suffering with ALS with this increasing physical limitation?
Yes. Mental health is extremely important when it comes to handling any situation in life, especially diseases, and especially a disease such as MND. And now in this era, I remember those initial days when I was practicing, you could hide the disease from the patient. Just tell the patient, doctor said nothing to worry, you will be all right in a few days, and hide and. But now, there's internet, the information is there, right there in your hand. Patients come to know. The moment they, know, okay, I'm suffering from MND, they Google it, and the first thing they read is, you're going to die maximum 4 years. Now, I don't know when I'm going to die, but I don't know that I'm going to die in 4 years. It makes a lot of difference. A lot of difference. It's like, I know my end is there, 2028. So, and it's definitely 2028. Maybe I might die anytime before that itself. This thought itself brings the patient down. So, mentally, he gives up. He does not want to do anything. The depression which comes in is mad. It's crazy. I have seen patients who just live with that crazy hope, and the moment I tell them, or any doctor tells them, okay, this is how life is, it's devastating. What I have been doing and what I think should be done is, number one, know that this is what the condition is and try to see what can I do at this stage. Like I always say, detecting the disease earlier and trying to intervene. Early intervention is always extremely important. If the same disease is detected in stage 1 or stage 2, we can do wonders. Like I have so many patients who are now doing well. But if it goes on to stage 3 or 4, then it becomes difficult. So whenever, at whatever stage the patient comes to know he or she is suffering from this, you have to accept the inevitable. And then plan a strategy around it. When you hear me out, you may feel it's all good. It's nice to talk about it, but then when a person is suffering from this, it's very difficult. No, it is not difficult. I have several hundreds and thousands of patients who have been able to fight this battle by just one, accepting the inevitable, say, yes, I have MND, I have lost my limb, I cannot walk, but I can do so many other things like Stephen Hawking did. I can do so many things, use this technology, use that technology. There are so many things, and patients are able to survive. So resilience, which I was talking about even in my TEDx talk. Resilience is something patients who are resilient are able to fight. So first and most important thing is to accept the inevitable. 2, to seek help. Have a support group. Look at people who are suffering from similar condition. So have a community. And you come to know, okay, they are following this and it is helping them, or share your joys and share your sorrows. Those little things which I was not able to do this, but since last 1 week my grip is better. That makes others feel good. Okay, he is getting some improvement. Maybe we can do that. So support groups are very helpful. 3, if at all the person is under severe depression or something, there's no harm seeking a counseling session from a professional, or even taking certain medications to remove or to alleviate the anxiety, to remove the depression which he's suffering from. So mental health is extremely important in most of the things, especially in MND, to help fight this disease and come back, maybe not come back to normalcy, but at least live a very comfortable life. They can also do other things, like meditation. They can practice. I had one very interesting patient from the US who had come to me about 6 months back. Young girl, about 30 to 33-year-old girl, and she had come for treatment, and I did the entire thing and I asked her, so when are you going back to US? She said, no, I want to tour the world. She was going to Maldives, and from Maldives to some other place. She said, I'm suffering, so what? She was a scuba diver. I want to explore everything I can, and that is, awesome. That's what I, would encourage everybody to do. And I tell everybody, suppose I know I'm going to die next week. This week I want to live my life. I want to do every single thing what I want to. I said, do that. For all you know, you may not die. You may live for the next 6 months or 1 year. So do what you want to do. Do you feel like doing. Enjoy your life. Sports, anything, go on the beach, lie down there for 1 full day if you want to. Don't just think I'm going to die. Yes, all of us are going to die. It's not something by sitting and crying. So mental health plays a huge role, and I'm here. I will not be modest. I feel good in saying that I helped so many people live happily for several years by just boosting their morale and just giving them, okay, yes, you can do it, and they're doing it.
So let's change the tone of the discussion. So I would want to ask I have some myths around ALS which I've come across over so many years, and I would like to ask you to crack those, bust those myths. The first one is that ALS is strictly hereditary.
No, it is not hereditary. Good question, because I would say more than 70% of the patients who come to me, their first question is this. Because when you see one of your dear one, the same thing is happening, you want to know, will it affect anyone else in the family? Which is a very genuine question. So let me once and for all clear this myth to everybody. Only 10% of cases are familial, which means 90% all of us have chances of not inheriting, even if our ancestors, our forefathers have it. So let us not live with that fear.
So anybody can get it.
Anybody can get
At
it
any point of time.
Any point of time. There is no reservation. In fact, this point brings one more thing, which initially during my practice I would see this disease only people who are in a highly placed in society. I cannot name those categories, but people who are in the elite category. But then as my practice continued, I see it. Everybody, men, women, educated, uneducated, employed, unemployed, irrespective of religion, race, age, anything.
I remember once we had this discussion where we really wanted to look into it, and we started, categorically writing down from where are these people coming, what is their age, what are they eating. I remember this discussion about vegetarian and non-vegetarian diet, and finally we gave up because there was nothing in common.
Because the initial time we were seeing only IAS officers, judges, bureaucrats and doctors, engineers, scientists. This was a category which was coming to us initially, and most of them were males. And then suddenly the trend started changing, and everybody is there. Anybody can have this disease.
Number 2, only older people get ALS.
Wrong. Yes, it is said it generally happens after the age of 40-45 years, but then taking you back again to Stephen Hawking, who developed this disease at the age of 21. He was diagnosed, and I have hundreds of patients in their 20s, in their 30s. It is not a disease exclusively of the older people. It can affect anyone at any age.
Now, number 3, ALS does not affect brain functioning.
That is also a myth because it is not 100% true. 20% of patients suffering from ALS have something known as frontotemporal degeneration. And I'm sure people are aware, or if not, let me explain here. The frontal lobe is the one which is responsible for our behavior. It is known as the seat of civilization. So frontotemporal, when there is an issue there, so patient's behavior gets affected. Besides this, we have something which we call as an ALS Parkinson dementia complex, where ALS is something which is affecting your muscles, voluntary muscles. Parkinson is something which is affecting the speed of your movement, and dementia is something which is affecting your cognition and memory. So ALS can affect the brain and the higher functions also. Besides this, there is an interesting thing which is found in ALS, which is known as a pseudobulbar effect. I'm sure you must have seen, so many of our patients who come here, they have inappropriate effect, what we call technically, where they suddenly laugh. You'll be wondering, this person is in such a miserable state, and why is she laughing so much? They just keep laughing, or suddenly they cry for no reason, and then the relatives are consoling them. Don't worry, you will be all right. We have come here. Doctor will make you all right. But she cries. Next moment, it's just a switch, and she's all right. So this is known as a pseudobulbar effect, which is very, very common. I would say I have seen more than about 40-50% of my patients having this. So yes, it can affect the brain as well.
Now, number 4. In ALS, you cannot experience pain and sensations.
You cannot experience. Why? You can. It does not affect the sensation at all. The sensations are 100% intact. It's only the voluntary muscle. You cannot move, but somebody pinches you, you can feel it. Sensations are not affected.
Okay. Number 5. In ALS, strength training is very important.
Wrong again. I said wrong with so much of emphasis because that's exactly what I see people. They come to me, I do a beautiful program, do so much with them, do a complete training program, give them, they go, and subsequently I realize the patient has deteriorated. On further questioning, we come to know they were just going to the gym, enrolling themselves and doing 5 kg, 10 kg, 12 kg weights. No, strength training, it is like you have limited number of muscles. Like I tell all my patients, imagine you have come to Bangalore with only 20,000 rupees. You will not be going to a 5-star hotel for a dinner. You will go to a small hotel, look at the menu and decide, should I order a meal of 300 or 500 because I have to be here for so many days. That's exactly how the training of patients in ALS is. The number of muscle fibers are limited and you're not going to get new fibers again. So you have to use them very conservatively. So strength training is a strict no.
And the last one, ALS affects everybody in the same way.
You know, it can affect, going back to Stephen Hawking, 50 years, he said, he lived. I've had patients whom I have done an online consultation. I have seen the patient talking to me. There was one patient who was driving a car. He stopped by and I spoke to him. I told him the entire treatment process. He said, okay, fine, I'm going to be there in the next, this was, I remember, the end of Feb sometime. He said, mid-March or third week of March, I'm coming to you. He booked his slot, but second week of March, we get a message from his son. The father is admitted in the ICU. He's on ventilator. He cannot breathe. This is a matter of 3 weeks. And there are patients who have been living for years together. I have my patients, 10 years, 12 years, 13 years they're living. It does not affect everyone in the same way. The progression as well. There are patients whose hand got involved and it's taken 2 years, 3 years to affect the other limb. It has taken 6 years to affect the speech and swallowing. 2 humans are not alike. ALS affecting 2 humans is not alike. It does not follow a set course. It can behave in any way.
What is it that you would want to tell the patient's caregivers? These caregivers are literally working round the clock. They're there for these patients. They're doing everything. They're taking care of their body, their food, their hygiene, their mental health. They're literally there. So what message do you have for these caregivers of patients with motor neuron diseases?
It is a very important and a very question laden with emotions here, and it is difficult for any caregiver to see their somebody who is so beloved to them. It could be anybody. After knowing the fact that my so-and-so is suffering from this disease, one, the patient himself or herself is undergoing the severe physical and emotional turmoil, and as a caregiver it becomes very difficult for you to control that, because I have seen that the relatives who come here, they want to put up a brave front. I don't know if you remember the daughter of one of our agricultural scientists whom we had.
Yes, I do.
She would put on a brave front.
Botanist.
Yes, botanist. And I was seeing her and treating her for depression behind the father's back. It is very difficult. So what I would suggest is, one, the same thing, accept the inevitable. This is how it's going to happen. So instead of joining their depression, you take care of yourself, number one. That's very important, because you are their pillar. You are their support. So if you are not strong, then you cannot, you cannot communicate it to them. Communicate not verbally, your body language, your eyes, your expression, all this will speak out. So the caregiver should take care of themselves, take care of their own mental health, remain calm, Use whatever activities they feel can calm them down. And again, join the support group where you can share each one's experiences, sit together. By sharing your sorrow, it reduces. You feel better. And this with that renewed strength and renewed courage, you go back to the patient, and then you are able to give them that confidence and support which they need. Plus, you need to have your own alone time. You need to have your own relaxation wherein you recharge yourself. Plus, whenever necessary, whenever needed, I would always recommend they seek professional help. Go to a therapist, go to a psychiatrist, take sessions or take medication, whatever will make them strong to take care of whoever is suffering from this terrible disease. And remember, you are more than a caregiver.
Okay, so what message do you have for, your colleagues and your counterparts in the field? Doctors who see patients with MND, who miss patients with MND, healthcare professionals, especially physiotherapists because they get a major chunk of MNDs, speech and language pathologists, occupational therapists. What is it that you would want to tell them, at the end, that what is the way forward for them?
Yeah, right. One, for the doctors, the people who are in this practice, I have seen patients come to me with this message: we went to so and so and he said there is no treatment, so nothing can be done, take your father and go back. Come on, you are a doctor, you're not God. You don't know what's going to happen to him or to you. I might die before the patient. This is such, I feel like just holding them and bashing them up. How the hell can you do that? You don't know. As a doctor, we are trained. Our duty is to treat the patient. Till the last breath, you are supposed to do whatever you can to save his or her life. Period. You are not God. You cannot change anybody's life. No, you cannot. Your job is just to do. Give the treatment, what is available, what is best, which has least amount of side effect, which may work, which may not work. That's not in your hands. There are so many surgeries which are done. So many people who die on the table. You mean to say we'll stop doing surgeries? We still do it. There's so many people. COVID. How many people were dying? We were all complaining. There are no ICUs, no ventilators. People were going there and dying. Will we stop doing? No. Similarly, MND is a disease. Yes, it is rapidly progressive. So what? Why can't we try to help these people? So for all my doctor colleagues, I would say, do not raise your hands. Even if you raise, don't tell the patient there's nothing you can do. You can change their life. You can
that kills the patient.
Exactly. That kills the patient. They come here crying. They said, we went to 10 places. Everyone says nothing can be done. I said, who said? Let us try to make you live better. There's so many things available to make, to improve the quality of life. We cannot, people ask, can you increase my lifespan? Can you make me live? How can anyone do that? We don't even know when you're going to expire. So how can we extend that? So that is one very important thing to all my doctor colleagues. Do not say you can't do. Help them in whatever capacity you can. Whatever you can. You can give them supplements, do it. You can teach them some breathing, do that. Do not say, no, you're going to die, I can't do that.
Or just refer them to some place.
Or just refer them to
care of
exactly them. Refer them to somebody who's doing some work in this. Who can at least 1% is better than 0. If I can improve 1% among 1,000, why not? I would love to do that. That 1% for his family, he's 100%. I have given, the entire family the person back. So I would love to do I will do it. I'll do whatever I can to save anybody's life to whatever extent, to whatever capacity I have. So that's my message to all my doctor colleagues and to other therapists, be it physiotherapists, speech therapists, or occupational therapists. There is a specific program which is designed for people with ALS, which is not equal to program which is for a patient with stroke, or a patient with spinal cord injury, or a patient with back pain or neck pain. I have seen people with MND being treated as if it's a shoulder
Shoulder pain.
sprain, something like that. So please read or seek help from your seniors, or seek help from somebody who specialized in this particular field. Do not think one method will treat everybody or will make everybody better, which is wrong.
So many times they are the ones spoiling the case.
They are the ones spoiling the case by doing, like you were asking me previously about strength training. I've had patients who have gone to places where they have done extensive physiotherapy, whatever they knew, they have done it thinking it will improve, and on the contrary, the patient has come back deteriorated. So there is a specific program which is meant for these patients, and I want them to read or refer them to places who specialize in doing this rather than spoil the case and spoil somebody's life.
So thank you for yet another very informational podcast. And today, I personally learned a lot about this very fatal, very bad disease. I just pray and hope that nobody gets it. Somehow it's eliminated and nobody gets it. There's a message for the patients that firstly accept the inevitable and then don't lose hope. Look forward, there are options. Just try to approach the right people, the right doctors, and hopefully you'll find a way out. There's a message for the caregivers that they are more than caregivers. They need to take care of themselves to take care of their patients. And most importantly, there is such an important message for the entire healthcare community to not just disregard this disease and just, put their hands up and just say that nothing can be done. They need to really guide their patients properly. They need to refer their patients to the right specialists if they are not in the right spot to treat them. They also need to learn about this condition, read about it, know what exactly is happening when a patient gets a motor neuron disease. How is it so different from the other neurological conditions? What are the contraindications? What can harm their patients? There's so much to know about these conditions. So thank you so much for such an informative session and for enlightening me and all of us who are listening to this. And hopefully we'll be able to make this world a better place for all these patients who are suffering so much.
You're welcome. Yes, it was a pleasure conveying, to the masses as to what this disease is all about and what is possible in this disease without any possibility. Well then, Dr. Naeem Sadiq from the channel Dr. Brainstem signing off. If you have any question or clarification, or you want me to talk about a certain topic, comment and I shall answer them to you. Till then, bye-bye.